We begin with breaking news from the Centers for Disease Control. It's just announced the first confirmed case in the United States of a potentially deadly disease called Middle Eastern Respiratory Syndrome, or MERS. Doctors say it's a virus that causes severe pneumonia and kills about a third of the people who get it. Officials say the patient is now in quarantine at a hospital in Indiana. Now the CDC reports it's looking for people who came in contact with him. John Roberts has more from Atlanta, home of the Centers for Disease Control. John?
John, this is a breaking story, and this is a big story as well. This is what everybody had worried about. Up until now, we had not seen Middle East Respiratory Syndrome here in the United States, but the Centers for Disease Control today confirming the first case here in the U.S., raising fears that we could see more. Up until now, there have been a number of suspected cases, but they have all turned out to be negative in the end. The person who brought the disease back from the Middle East is a fellow from Indiana. He went to the Middle East a little more than 2 weeks ago. He was in Saudi Arabia, where it's believed he picked up the virus. There has been a dramatic explosion in the number of MERS cases there in Saudi Arabia. On the 24th of April, he boarded a plane from Saudi Arabia bound for London Heathrow Airport. From Heathrow Airport, he then caught a connection to O'Hare Airport in Chicago, and from there he got on a bus and went back home to Indiana. British public health authorities are urgently looking for people who are on that flight with him from Saudi Arabia to London, while the Centers for Disease Control is looking for people who were on that flight with him from London Heathrow Airport to Chicago and then on that bus back home to Indiana. Now, what is Middle East Respiratory Syndrome? Well, first of all, it's caused by something called a coronavirus. A very similar virus causes the severe acute respiratory syndrome that we saw come out of China a few years ago. It causes severe respiratory illness, fever, cough, shortness of breath. This is the most troubling part of this. Look at this fatality rate among confirmed cases, anywhere between 30 and 50%, and among some groups, it's even higher than that. It's spread through close contact between people. So far, there is no sustained spread, human to human, but there have been some clusters. Dr. Anthony Fauci of the National Institute on Allergies and Infectious Diseases tells us more about those clusters.
People who've gotten infected and have either infected very close family members, and then it stopped. It never went beyond the household. And then in some healthcare settings, there has been situations where a person was infected and then infected the healthcare worker that was taking care of them.
The big concern in all of this is that with a few small mutations, this is a virus, John, that could become easily transmissible between people, because we saw that with SARS coming out of Asia a few years ago. John?
So if it is easily transmissible, how exactly does it spread?
Yeah, well, if it's not easily transmissible, so far it spreads through fairly close contact between people. Kissing, for example, saliva as well. If you share a glass or an eating utensil, perhaps even food with somebody. If somebody who was infected were to cough into their hand, you shook hands with that person, and then you touched your nose or your mouth. At the moment, what we know about this virus is you have to have a fairly large number of virus particles enter your respiratory tract to get sick. But with the way that this is exploding now, and there have been more than 140 new cases in Saudi Arabia in just the month of April, that's more than there was in the entire past year. Centers for Disease Control folks at the World Health Organization, very concerned that this virus may already be changing, John.
And because it's a virus, antibiotics are not going to do any good, right?
That's the thing. You can really only treat the symptoms when it comes to Middle East Respiratory Syndrome. There is no treatment to get rid of the virus, and there's no vaccine, though you can bet if we see more cases crop up, particularly here in the United States, there will be a drive on to create some sort of vaccine very quickly. And
if close contact is the way this thing is spread, I imagine they are desperately trying to find everybody else who was on that bus with this guy, huh?
They are, as we mentioned, on the plane from Saudi Arabia to London Heathrow, the plane, and we're trying to get the flight and the number and the date. We believe it was either the 24th or the 25th of April from London Heathrow to Chicago, and then on that bus as well. What we understand is that this fellow is in a negative pressure isolation tent, and healthcare workers who are dealing with him are having to wear protective gear. A GO team from the Centers for Disease Control, as we understand, is either on its way there or is already there to look after this.
Yeah, because it's my understanding that many of the cases have involved health professionals who were trying to treat patients who already had MERS.
They have. Initially, Middle East respiratory syndrome was thought to be a disease of people who were older and more frail, people who already had existing medical conditions. But just recently, a baby who was just months old developed this and died. It's been seen in children. It's been seen in people who are in their mid-20s who appear to be otherwise healthy. So that's why this is so troubling, John. And now that it has come here to the United States, of course, this raises a big public health alarm. The CDC has been very vigilant in monitoring this. That's why they caught this so quickly. But what you have to remember about MERS is, while that mortality rate, as we've seen, has been between 30 and 50% among most people, there may be a lot of people who had this and didn't even get sick. So we don't know the entire scope of this yet or exactly how deadly it is. But among people who have become acutely ill, who have these confirmed cases, the mortality rate is troublingly high.
Yeah. John Roberts with the concerning news that the first MERS case is in the United States, first known anyway. John, thank you.